for watching CT Style. With summer months ahead, many folks are looking to wear their shorts, skirts, and dresses, and of course they want to be comfortable too. And that's why you want to make sure your vein disease is treated properly. That's why our good friend is here to help, Dr. Alex Afshar from the Vein Institute of Connecticut. Doctor, welcome here to CT Style.
Thank you.
It's interesting. Absolutely. We talk so much about the aesthetics of vein disease, but there's actually more than that. There's a side on the medical angle. Tell us about that.
Well, the symptoms of vein disease can be very subtle, but they can include cramping, leg pain, restless leg syndrome, which is one of the two causes of restless leg syndrome is vein disease. Yep. Tired, heavy legs, swelling, which a lot of people get, and just generalized leg pain at the end of the day.
Oh boy, and that can affect your sleep too, right? Other
Absolutely.
parts of your life.
Restless leg syndrome and cramping can absolutely affect your sleep, yes.
And what is it typically caused by? I know number one is genetics, but there are also some other factors at play.
Number one cause is genetics, absolutely right. Second most common cause is 2 or more pregnancies. Third being trauma, and then going down the list with obesity, occupation, so forth and so on.
Oh boy, so what can be done if you do suffer from this?
The first step would be to get a consultation, of course, to see if that really is the cause of your symptoms, and then do an ultrasound of your legs, and then get authorization from insurance, because it is covered by insurance. It's a medically necessary procedure, and then you close the main trunk that is causing the problem and has the backflow, then you treat the superficial veins.
And this treatment has changed over the years, though, right? It's a lot easier in terms of recovery time for a lot of the patients now as to opposed 10, 15 years ago?
That was actually a question that came up just before we started. It's, there is really no recovery. The only limitations you have afterwards are you must walk at least 40 minutes a day, which is a good thing.
Right, that's not a bad thing. You should do that anyways.
Yes, exactly.
It is National Running Day, so you know, it's kind of
or running.
Sure.
And compression stockings for a week, maybe 2 weeks, depending on the procedure.
And the procedures, what can they entail?
Well, the first step, that it's like looking at a tree. So the first step, if the problem is coming from the trunk, is to close the trunk down. Then the branches that come off of the trunk become varicose veins. Those are removed in office. That's not stripping. It's called ambulatory phlebectomy. And then treating the very superficial veins, which will give you better aesthetic results like spider veins.
Okay, all right, so that's the difference between all those. It's interesting to kind of learn the difference there, and it's great because you have 3 locations and another one on the way coming up here in Milford. So remind all of our viewers at home, if you're not familiar, where we can check you out.
Newtown, Westport, and Fairfield.
Very nice, and make sure you guys...
Where's the new one opening? Yeah.
Hopefully in September. We are currently looking at Milford, but that could change.
All right. Well, let's hope. I mean, it's here close to the station. Make sure you guys log on to veininstitutect.com and make sure you give our friend Dr. Afshar a visit. We want to thank you, as always, for joining us today on CT Style.
Thank you for having me.
Awesome.
Thank you very much.